This is Dr. SWD and we're going to learn a little bit about ECGs today, right? I'm trying to make this video shorter than 20 minutes so you could just fast forward and learn if you want, right? So first thing that you need to know is that there's a P wave, there's a Q wave, there's a R wave, there's a S, there's a T, right? So what you need to do is first you need to understand that what are the steps of learning it. The first thing you do is you calculate the rate, then you look at the regularity. How we do that? We do it right now in a bit. Then you look at the P waves, you look at your PR, you look at your QRS, you look at your Xs, and then your morphology. Now, before I go any further, I want you to know what you would look for in these things, because that is all that is important for your PLAB 1, right? I guess that's the thing, right? So first thing is rate. So you want to look at if there is a tachycardia or a bradycardia. Forget about if there's a fibrillation or if there's a ventricular part to it. Just first you have to determine the rate. All right, then you have to look at the regularity. For that, you have to see whether it's a fib or a flutter, right? That's how you'd see your regularity. Your P wave, what you're going to look for in there is again your flutter or fibrillation. All right, or fibrillation. Okay, then your PR interval would be for the blocks, right? First, let's just revise how many types of blocks are there. There are 3 types of block: 1, 2, right, and 3. Okay, so your 1 is the one where your where your PR interval, right? You're looking at the PR interval where your PR interval goes above 0.2, right? There is a lengthening to it, so it just goes above 0.2. Your type 2 has 2, which is your Mobitz 1 and 2. Type 2 has 2. Mobitz 1 and 2, right? So Mobitz 1 and 2, what you're going to think about that is that when you're thinking about Mobitz 1, you would be thinking of a husband who keeps on coming late. That means your PR interval keeps on increasing. Then suddenly that husband doesn't come. That means there is a dropped Qrs complex, right? Mobitz type 2 is a very good husband. He keeps on coming on time. Your PR interval is just fine. Everything looks normal. One day he doesn't come, so that's far more dangerous, right? Okay, then you have your type 3 where there is no relation between P and Q, because obviously if there's a divorced couple, there would be no relationship between P and Q, but try to remember it like that, all right? Okay, that is for your blocks. After you're done with the blocks, like you would be looking for your blocks in your PR interval, the next thing you see is your Qrs complex. Now in Qrs complex, what is important? These things are important. You'd be looking at first thing, and the first thing is to see whether there is a ST depression. What is wrong with the ST segment? You have to see if there is a depression, if there is an elevation. Those are the 2 most important things that you need to see in your Qrs complex. The next things you want to see in the Qrs complex is a T, whether it's a tall tented one to see if it's hyperkalemia, or if it's a depressed one, an inverted one, to see if it is your hypokalemia, and we'd be learning about what you do with the treatment. Then you have to look at the Xs and morphology. That just comes later on. So again, let's revise. What do? You look at the rate. I'll be telling you how to. Then you look at the regularity. Then you look at the P waves. You look at the PR. You look at the QRS, the Xs, the morphology. The most important thing in here is the rate, the P waves, the PR, and the QRS, because the rate would tell you whether it's a fib, whether it's a techie or brady. If it's a brady, then we'll be looking for the hard blocks and we'll be focusing on the PRs. If it's a tachycardia, we'll be looking at the Qrs complexes and the P waves, right? Because we'd be looking at the flutter and fib with the P waves, and with the tachycardia, we'll be looking at the Qrs complexes to see whether it's a narrow or broad complex tachycardia, depending on what is happening with the patient, right? Then you have to look at the regularity again to see the flutter and fib. Then you have to look at the P wave to see whether there's a drop or if there is a morphology problem. Then you would look at a P waves would show you if there's a flutter or a fibrillation again, right? Your PR would tell you whether there is a block or not, and your ST segments, your QRS would tell you when you look at the ST if there is an elevation or drop to see whether there's a depression, whether there's an ischemia or an infarct. Your T waves will tell you whether there's hyperkalemia or hypokalemia. This is all you need to know about your ECGs. Now let's move to the ECGs in here and see what we learn. Then another thing is, let's just move to the very top of it before we come to the back and look at the main kinds of ECG that you might see on your exam day. So first, let's see what you do. The first step always is to look at the rate. First thing, you look at an ECG, forget about how it looks. Look at the rate, if that is good or not, if that's a regular one or not. Look at the rate in here. right? To calculate the rate, you'd be looking the RR, right? So this is a rate. What's the rate? One big box is 300. All right, so there are around 4 big boxes in here. How much this would be? This would be around 60 beats per minute, almost 60 beats per minute, right? So there is a rate which seems regular, kind of, right? Kind of a regular rate. After you look at the rate, what's the next thing you do? You look at the P waves. Now, where are the P waves? These are the P waves. What do the P waves show? Whether there's a flutter or fibrillation. Okay, this is your P wave. This is your P wave. This is your P wave. Now, the P waves do not show any flutter, right, where you have a sawtooth, or a fib, right, where it's a regular P wave, right? So this just seems like we're not looking at those things. It could not be either a flutter or a fibrillation, right? So you looked at the rates, you look at the P waves. After you looked at the P waves, you look at the PR interval. Now let's calculate the PR interval. This is your P wave, the beginning of it, and then the end of the R. So this is your PR. So this is your P wave, this is your end of the R, beginning of the P wave, end of the R. Okay, let's look at the other one as well, right? This is kind of a flattened P, but we're not going to consider this one, right? So PR seems fine. Nothing to do with the heart blocks, right? You're not thinking heart blocks. Again, let's revise. You look at the QR, you look at the RR interval to check the rate. After you've checked the rate, what do? You look at the P waves. The P waves would tell you whether to look for a flutter or a fibrillation, which we don't see in here, right? We don't see in here. The P waves look fine. After that, you look at the PR interval, which is over here. This seems fine. Nothing with here. No increase, no change, right? So there is no block. We're not thinking block. The next segment we want to look for is your Qrs complex. Now let's look at the Qrs complex in the lead 1. So again, I'll be doing with each lead and telling you the steps. The first thing is to look at the rate. I know it's repetitive, but it is important that you learn, right? So even if it's repetitive, it's better that you learn, right? So the first thing, you looked at the ECG, you're looking at one lead. What you're looking at? You're looking at the rate. Calculate the rate. The rate seems fine. The rate seems fine. The rate seems fine. Whether it's regular, yes, it's very regular. There is no difference in there. Then look at the P waves. These are the P waves, Now look at the morphology. Is there a flutter or fibrillation? None of it. Then you look at the PR, calculate the PR from the beginning to the end till you see a Q, right? So this is your PR interval. Is this PR interval fine? Let's calculate it over here. Okay, the PR interval seems fine. The PR interval seems fine. The PR interval seems fine. So you're not thinking blocks. You're not thinking heart blocks. The next thing is to look at the Qrs complex. Now let's look at the Qrs complex. See, this is your baseline. There is a shift from baseline of the ST. So there is an elevation, right? This is your baseline, right? This is elevated. So this is your ST elevation, right? In lead 1, we're seeing ST elevations, right? Let's look at your lead 2. All right, again, what's the first step? You look at the rate. Okay, you look at the rate. Rate seems fine. All right, the next thing, you look at the P waves. All right, you look at the P waves. You look at the P waves. No flutter, no fibrillation, kind of seems regular. So we're not thinking fibrillation or flutter. What do we do next? We look at the PR interval. This is your PR interval. From the beginning of the P wave to the end of the R. This seems fine over here. Right, look at the PR, seems fine. Again, the PR seems fine. This is your PR interval, fine. So we're not thinking of heart blocks or flutter or fibrillation. Now we're going to look at the Qrs complex. The Qrs complex here seems that there is a dip in, right? There is a dip in. Could be an old Q wave, right? In lead 2. Is there any elevation? Is there any elevation? A slight elevation is seen, not that prominent. All right, now let's look at this one. This one, what do you see? A very dipped S wave, right? And also look in here, like see, this is your baseline, right? Again, we're going to determine and start by what? We're going to look at your R waves for regularity and your heart rate. So this is your R wave, looking fine. I mean, I'm just making you repeat it, right? So you know what are the steps. So first time you look at the ECG, what you do, you look at the R to see the heart rate. The heart rate seems fine. Then you look at the P waves. These are your P waves. P wave, seems fine, kind of depressed in here, kind of flattened, but fine, right? Then you look at the the PR interval, looks okay to me. The next thing what you do is, so you're not thinking blocks. The next thing what you do is you look at the Qrs complex. Now Qrs complex over here, this is the base, but you see that there is a drop, right? This is your baseline, again your baseline, right? This is your baseline, but there's a drop, right? So this is your ST depression. Okay, ST depression. Now let's look at the other leads, right? We're looking at AVR. AVR has a prominent depression, but first we're not going to jump into it. First, let's calculate the rate. This is a rate. This is the rate. Rate seems fine. You look at the rate. After rate, you look at the P waves. P waves are here. This is your P wave. This is your P wave. This is your P wave. Look at the PR. PR seems fine. PR seems fine. PR seems fine. Because, you know, there's not going to be a change in any of the leads if there is no change in one of them, right? So because that's what the heart does, right? It's going to shoot the same kind of wave throughout the heart, right? So if there is no change in any of the 1 or 2 leads, there's not going to be change in any of the other PRs as well, or the morphology of the P. So here we have determined that the rate is kind of constant. We've determined that the P waves are fine. We've determined that the P, so you see the rate is constant. The P waves are fine, not the rat, but rate, right? P waves are fine, the PR is fine. So we're not thinking fibrillate, we're not thinking tachy or brady, right? We're not thinking flutter with the P waves or the fibrillation. We're not thinking blocks with the PR intervals, all right? So the next thing is we're going to determine what is in the Qrs complexes, all right? Let's see what is in the Qrs complexes. Now look at the Qrs complexes. Let's look at the baseline. This is a baseline. Okay, there's a drop. This is a baseline. There's a drop. ST depression. There is an ST depression. Okay, there's ST depression and AVR. Now look at the AVL. Again, I'm going to say rate, P's, PR. PR seems fine. No blocks, nothing to do with that. Maybe to do with the elevation. Now this is your baseline, right? See, there's an elevation. This is your baseline, elevation. This is your baseline, elevation, and kind of the T waves as well, but not those prominent T waves, right? Not the tall tented ones. Okay, all right. Okay, again in here, look at the rate. After you've looked at the rate, what do? The next thing is to look at the P waves. All right, this is a P wave, kind of fine. P wave, kind of fine. You look at the PR just to see if there is a block. No block. All right, no blocks. Then what do? You look at in here and you see that there is kind of a elevation, a little bit of elevation. Okay, now look at in here. What is it? So prominent. RR fine. RR fine. P wave, kind of inverted. Right, RR fine. P waves, these are your P waves, All right, now look at the Qrs complex. Now in Qrs complex, you guys remember I told you that in your Qrs complex, you're looking at 3 things, or maybe 2 things. What are you looking at? You're looking at the ST segment, whether there's a depression, as you saw in here, whether there's a depression. In your Qrs, you're looking for 2 things in your PLAB, whether there's a depression, like with the ST segment, that's the first thing. In your Qrs, you look at whether there's a depression or there's an elevation. There's such a prominent elevation, right? This is the baseline, elevated ST segment, right? Elevated ST segment, right? Okay, and also the next thing you look at is the T wave. The T wave is elevated and kind of tall and tented, right? So there is ST elevation with your tall tented T waves. Could be hyperkalemia in the patient, right? Or this could be because of the infarction, right? So in Qrs complex, what do you look for? You look for your ST and your T. Right, so there is a depression over here, as you saw, inversion of the ST, and then there is an elevation, and also there is a tall tented T. All right, guys, so this is your infarction. Now, once we've learned this, the next thing we want to know is which part of the wave, which wave would tell us what is happening, right? Which wave, which lead tells us what? Which lead tells us which part of the heart it is? Okay, so your lead 1 is going to show the lateral part of the heart. Lead 1, lateral part of the heart. Your lead 2, lead 3, AVF, inferior part of the heart. All right, lead 1, lateral part of the heart. Lead 1, 2, 3, 2, 3, AVF, not 1, 2, 3, AVF, inferior part of the heart. Lead 1 and lateral part of the heart. Your V1, V2, V3 are typically for the anterior part of the heart. And your V4 is your septal. So this is your anterior septal part of the heart which is involved, and it is having your what? It is having your ST elevations. Yes, it's you're having your ST elevations as you see in here, right? You see in here, you see in here, you see in here. These are your ST elevations. So this is your anterior lateral, anterior septal, not lateral, because for lateral you need lead 1, lead 5, and lead 6, right? 1, 5, 6 lateral. Think like this. Remember like this. 1, 5, 6 lateral. 1, 5, 6 lateral. 1, 5, 6 lateral. Right? 2, 3 AVF inferior. 2, 3 AVF inferior. 2, 3 AVF inferior. Right? Lead 1, V1, V2, V3, V4 is going to be your anterior septal, right? Lateral is 1, 5, 6, which is again your lateral part of the heart. Now, which supplies what? All right, your inferior part of the heart is supplied by what? Your inferior part of the heart is supplied by the right coronary artery, and for inferior 2, 3 AVF, right coronary artery, right? Your lateral part of the heart is supplied by what? Left anterior descending artery, right? So V1, all right, V2, V3, V4, which shows your anterior septal, is supplied by the left anterior descending artery, left anterior descending artery, left anterior descending artery. Don't forget these. These are really, really important, and just the basics that we need to know for the PLAB. All right. Okay. So, okay, that is important for this one. Now let's look at this one. All right. Look at the PR interval. It starts from here. This is your P wave. Goes in here. Starts from here. Goes in here. Okay. PR interval starts from here. Goes in here. What kind of thing is happening? There's a raise in your what? There's raise in your PR interval. No, there's a raise in your PR interval. So what is it? It's your type 1. No, it's your type 1 because there's a raise in your PR interval. There is no drop of the beat, so this is your raise in PR interval, and that is what is happening here. All right, guys. Okay, let's move to the next thing. All right, let's move to the next thing. Okay, clear, everybody. I'm hoping that everybody's clear because I cannot hear you, right? Okay, that is what is happening here. Okay, let's move to the next one. Seems kind of that. Right, we just look at the ECG and would determine. All right, over here. Now let's see what the first thing that you do. You look at the RR. You calculate the rate. The rate seems fine. Next thing you do is you look at your P waves. Do you see your P waves here? No P waves. Kind of no P waves. But here, look at this one. We do have your P waves, right? Okay, your P wave. Sorry, this is not your P wave. All right, what's the next thing you do? You looked at the RR, you looked at the P wave, you look at the interval, right? So let's just take this lead. All right, let's take V5. All right, so RR, rate, heart rate is seen. Now let's look at the PR into the P wave. This is your P wave, this is your P wave, and we do not see another P wave. Let's look at the P waves here, right? What do the P waves show? Look at the PR. Look at the PR. Right, kind of raised. So what is it? It's your type 2, right? It's your type 2, Mobitz type 2. Okay, why do we say it's your Mobitz type 2? Would be determined over in this lead. Let's look at, I chose the wrong one, right? So here you see you don't have your Qrs complex. You don't have your Qrs complex. So this is your P wave. Sorry, this is your P wave, this is your P wave, a dropped wave, right? So this is your Mobitz type 2 that the person keeps on coming late and then there's a drop. Sorry, the person keeps on coming on time and then there is a drop. All right, okay. Now what is this one? Look at the QRs, right? First look at the P, the RR, determine the rate, look at the P, right? I'm going to zoom in a little, look at the P seems fine. Nothing to do with the PR interval. PR interval seems fine. So what do we do next? We move to the Qrs complex. Right, in the Qrs complex, you have to see whether there's a ST elevation or not. To determine the ST elevation, look at the base and look at the S. I mean, this seems fine. It's not a notch. It's not like this, right? It's not slanted. It's fine. It's a straight line. So S is fine. But look at the T wave. There's a camel hump. Right, there's a camel hump. So this is your U wave, or this is your T wave inversion, which is seen in hypokalemia. If you see over here as well, you would find one. This one is your T wave, right? Prominent U wave. That there is a biphasic T wave, also known as a camel's hump. All right, now let's look at the other ones and let's look at the tachycardias. Right, let's look at the tachycardias, and which is this one? I'm gonna give you a minute to just look at it. I know you guys aren't there, but I'm hoping you guys are listening. See, now when you're looking at the Qrs complex, right, first let's see whether there's a tachycardia or not, right? So looking at the RR interval, this is your RR, okay, this is your RR, seems like a tachycardia, right, seems like a tachycardia, but to determine whether it's a problem of the P waves or the QRS, you have to look at the P waves, right? Do we see prominent P waves? We don't in here. I mean, they're kind of fine, but we know that there's a problem with the Qrs complexes. Look at the Qrs complexes, right? Now, to determine whether it's a broad complex or a narrow complex tachycardia, we have to look at the, right, we have to look at the complexes, right? So this is narrow complex tachycardia, right? Narrow complex tachycardia. So your narrow complex tachycardia, which is your VT, right? Which is your VT, right? Okay, again, this is just your VT, right? Okay, this is just your VT. All right, then Okay, that's the one. So we are gonna end it over here because this is what we wanted to know.